station, Salam Radio 106.2 FM, and indeed Luton's Inspire FM on 105.1 FM. What a delight it is to join you today in this beautiful sunny weather. Yes, the time is 7 o'clock, and it has been wonderful to have you on board and join me yet again on this wonderful information-packed show. And I'll tell you a little bit about my week. It's always a busy week. I'm a general practitioner within the city, and I see a lot of different patients. I see a lot of different things. Last week I was out and about on a Friday, and I met this ever so delightful little girl by the name of Shaima. I think her name was Shaima. Do forgive me if it's wrong. She does live in the centre of Peterborough. She met me at the doorstep. She's a wonderful little girl, and I wanted to give her a shout out today. So if you're listening, I hope that you're appreciating the shout out to you, Shaima, because the fact of the matter is it's wonderful to have the youngsters on board to listen to the show. And without further ado, we're going to introduce to you the topic of today's show. Now, it is perinatal or maternal mental health week. And in honour of Maternal Mental Health Week, I've got a wonderful guest on the show, and I'm going to talk to you a little bit about her introduction. And it's great that we have professionals on this show. We take out a lot of valuable time, like all of the Salam Radio presenters do. We do all of this voluntarily and try to get the best speakers on our show so that you are well informed as a community and can be enlightened with some of the knowledge bites that we give you. And I'm particularly interested in perinatal mental health because of the fact that I myself have suffered from postnatal depression. I make no hidden story about it. I'm very proud to announce that I've got through it. I had a lot of support. I went down the right path. I talked a lot, as you can all tell. I like to talk a lot and come through it. And since then, I've been blessed with a beautiful family of 4 children, alhamdulillah. So it's wonderful. And indeed, it's a privilege to be able to talk to you about it. Now, my wonderful guest today is a Miss Afsheen Malik. She's a consultant obstetrician and gynaecologist at the Heart of England NHS Foundation Trust. She completed her MBBS at King Edward Medical University, Lahore. She was appointed a consultant at the Heart of England NHS Trust in October 2016. She practices both obstetrics and general gynaecology, and her lead roles are she's the lead obstetrician for Perinatal Mental Health for the Heart of England NHS Foundation Trust and the lead consultant for Junior Doctors Rota at the Good Hope Hospital. And her other main interests are high-risk pregnancy care, intrapartum care, diabetes in pregnancy, undergraduate and junior doctor teaching and training. And we're going to be discussing perinatal mental health with her, and it would be wonderful to have your company on the show. So if you want to ring in, if you're outside Peterborough, don't forget to tap in the outside Peterborough code, which is 01733 602133, or you can text and WhatsApp us on 07745 278978, or you can join us on Facebook Live, Twitter Live and YouTube Live. How's that? So without further ado, I am going to be introducing my guest, Miss Afsheen Malik. Miss Afsheen Malik, Assalamu alaikum.
Wa alaikum salam, Shabina.
It's wonderful to have you on the show, and thank you very much for making time out in a very hectic schedule, I can understand, because I can never get hold of an obstetrician consultant because they're always on their feet, aren't they, in the hospital?
Yes, they are. Well, first of all, thank you so much for a very lovely and an elaborate, I think, introduction. And I'm really, really honored and thrilled to be here. And I think the topic is so interesting that probably the time for the show is probably going to be little, and we can talk for hours about that.
That's correct. And I can't tell you how much I've waited for this, because I do think that so much needs to be done in terms of creating awareness and making the community, especially the Muslim or a Southeast Asian community, aware of mental health. And with regards to the whole subject, could you tell me how, and our listeners indeed, how you came to develop an interest in perinatal mental health, please, Miss Afsheen?
Shabina, that probably I think it's an interesting question. I really have to think about it. But I think it probably goes back to the time of my training. And as you mentioned, I'm a rather new consultant. I was appointed in 2016. Sure. So in the last 2 years of the training, I had the opportunity to visit the mother and baby units. You might have heard these are a few units across the country where women who've just delivered and have severe mental health problems are kept inpatient with their babies, with their families as well. So I really enjoyed and rather found that experience, to be honest, very fascinating. Because the way how they work, the psychiatric units, is very different to the obstetric units. And as you mentioned, obstetrics and obstetricians, we're always running around and we're always dealing with lots of emergencies. However, at that end in the psychiatric wards, it's a different world. The ward rounds are at length, and they have their families present as well. So you don't just see the patient, but you actually see the impact of their mental health problems onto the whole family and the baby. So I think this is how I felt that this is something I'm really interested in and I want to take it further. And I think the more you see, the more you study, it became more and more interesting. And I think fortunately I had a very good mentor as well who supported that interest and nurtured that interest, and I was able to take it forward and doing what I'm doing now.
Wonderful. So it's a very niche, I think, speciality, especially when it's mixed in with obstetrics, where one often thinks that you're more related to the medical aspect of things, but I think that this is a wonderful service indeed if it's been set up in the Heart of England NHS Trust. And can I ask you, for purpose of information for our listeners, which patient group does this primarily involve?
Yeah, so Shabina, this, as you said, it's perinatal. So typically it involves any patient, any woman who is pregnant and up to 6 weeks after delivery. And this includes all the women who've got any pre-existing mental health disorders or any new diagnosis during pregnancy or around delivery, and very importantly after delivery as well, because there are a small number, but there's still definitely some patients who have some problems developing after delivery. As you mentioned, postnatal depression being top of the list. And also postpartum psychosis, which is rather rare, fortunately, but obviously much more severer in terms of disease spectrum.
Sure. And in terms of prevalence of perinatal mental health problems, we're talking about a very wide spectrum, so there probably might not be any specific statistics. But how prevalent is this problem, given that depression actually, on the whole, is probably one of the topmost conditions, encompassing all the physical conditions as well, in which people are affected? So how prevalent is perinatal mental health, would you say?
Shabina, you'll be surprised, and to be honest, I was surprised as well when I read it first time. The prevalence is much higher than most of us think. I'm talking particularly about perinatal mental health problems, which is occurring in and around the pregnancy and childbirth, and according to one of the WHO papers, it's about 10 to 20%.
Wow.
So that's quite a lot. 20% mounts up to 1 in 5 women. So that's a lot of women actually. And saying that, there's a very interesting paper which I was reading a couple of weeks ago, which says that only 50% of the mental health disorders are actually detected. So whatever numbers and figures we know of only relate to the 50% of the population. Okay. There's an equal number of women or adults, I would say, which are out there and still suffering and still needing some help.
Right.
And when I say 10 to 20% overall, there's definitely this number is much higher in some certain at-risk groups than other. And namely, less than 25-year-old, the younger population. Again, according to the same paper, they say that about 1 in 4 less than 25 years old have got one or another mental health disorder. So that's quite a lot if you think about it, 25% of our younger population. And in that group, particularly, generalized anxiety disorders are much more common. And, that tops the list as compared to depression as well. And then there is another group which I think which is relevant to particularly to the talk today is our immigrant women, immigrant population, asylum seekers and refugees who have a lot going on in their life. It's and they are recently, moved into the country. It's all new society, all new culture. There's friends, family, and language barrier is a huge problem as well, as you can imagine. And nobody to talk to. And these women, sometimes I'm sure you must have seen a few of such patients in your surgery as well, who come with rather more physical or somatic symptoms rather than actually, psychological symptoms, because they're not able to name it or pinpoint it to something which is probably related to mental health. And for example, generalized aches and headache or palpitations. But if you spend a little bit more time and try to sort of like get to the bottom of that, it's one of the mental health disorders, rather than actually any physical illness.
Yeah.
So, so these are the few, I think, at-risk groups where the prevalence is even more than the numbers which we quote of 10 to 20%.
Yeah, I mean, it's staggering that 1 in 5 pregnant women will experience some type of a mental health issue.
Absolutely.
And I think, we go into the intricacies, especially when a woman has given birth, Miss Afsheen, or Miss Malik. And what I've noticed, especially with my own, and I share this because I want people to take inspiration and I want people to feel that they're not alone. But when I had the birth of my first child, you actually you're not quite prepared. Nobody gives you a manual book. There's a lot out there to read. There's a lot to give you in terms of choice, but you don't actually realize the amount of trauma that your body goes through when you are giving birth to a child. And then all of a sudden you have this little being, nobody tells you how to look after it. And you look at it and you think, wow, I have to look after this child. It depends upon me wholly, and I'm having to take care of its emotional needs, its physical needs. I'm having to sacrifice my sleep, my rest, and my body's repairing at the same time, and that can be quite overwhelming. And with I don't really like to use the word rush of hormones, but I do think that whilst your body is in the recovery process and with having to negotiate so many things, as well as the needs of a little child, it can have quite a traumatic effect on the body. Don't you agree? And that's what happened with me.
Absolutely. I can't agree more. And I think going back to the first thing which you said, I think that's something which is worth appreciating and applauding, is that you share that you suffered from postnatal depression. I did as well. And I think so many of the women, suffer from postnatal depression or one of the other problems. And this is the thing, I think, where we need to remove that stigma and be a little bit more open and, talk to our friends. I sometimes go to my patients as well, because you really need to come up and forward and say, about these things. I think not just in our society and in our culture, definitely there is a lot of need to create awareness about this, remove that stigma. Physical illnesses we are more open about that. You see a patient in the clinic and somebody will walk in and you say, if you've got any problems, and they'll say, yes, I've got diabetes, I've got high blood pressure, but they will not probably mention any mental health disorders, although they might be suffering most because of that. So, there's a lot that can be done about increasing that awareness and making them realize that mental health issues are as important as having any other physical illness or physical problem as well.
Absolutely. And mine was diagnosed because I completely brushed it under the carpet. It was only when I had a health visitor that came on my daughter's, I think in those days they did have 8-month checks. Now they don't really have them. This was in London. And she came home and she asked me just to fill out a questionnaire, and it was the Edinburgh depression score, I think, at that time. And I filled it out, and when I answered it truthfully, and she looked at it and she looked at me and she said, "Oh my goodness, you poor thing." I'll never forget that she said that. And it made me pulled down my barriers, and I completely broke down in front of her. And it wasn't because of anything else. It was just because I had no understanding of what I was supposed to do. And it was very difficult. I was very tired, and I'd stopped working. I'd be very active, very ambitious. And then all of a sudden you're thrown into this role of motherhood, and you don't realize how it's going to turn out. So it's been wonderful, actually, that you've expressed all of that, because I'm really hoping that those of us that are listening, and we've got quite a few people that are listening right now. I'm going to obviously quote a few names. We've got Aruj Shah who's listening, so thank you very much for joining us. And we have Sarwat Awan and Nazi Naseeb and Mr. Faz Ali. And I'm so grateful that Mr. Faz Ali has joined, because he's actually a man, and it's so important for men to listen in on this show so that you have an understanding of how these conditions are in women, because if the men don't understand, it's going to be difficult to suss out what's happening, isn't it?
Oh, absolutely, because mental health issues, I mean, there's lots of charities and lots of organizations working, there's lots of research as well. These mental health problems, especially postnatal depression, postpartum psychosis, these conditions not only affect the mother, but it affects the whole family. The impact on the family is huge. So yes, I mean, I'm glad there are some male listeners as well, because this is how you actually create awareness, and they're able to support their one family, and that actually extends from one to another family.
Yes, that's true. And this is where the stigma surrounding mental health can be abolished, so that people can identify. And I think before I go on to my next question about identifying, would it be okay if you gave our listeners a little bit of an insight into what conditions primarily are we dealing in mental health with, depression being one, and I think you spoke of psychosis. Are there any other things? Are the prevalent ones really, aren't
yes.
they?
Yeah, Shabina. So if we say, the common ones, which most of us are aware, is generalized anxiety disorder. I think that is on the top of the sort of like in terms of numbers, it affects about 15% roughly. You see more and more patients who are coming up with different sort of like spectrums of generalized anxiety disorders. Depression, again, being about 10 to 12% and to 13%, but that sometimes is sort of like classified into different other categories. Eating disorders, you might have come across. Eating disorders are quite, I wouldn't say common, but I've seen quite a few patients in a short span of time. And then affective disorders like bipolar disorders, schizophrenia, they are fortunately uncommon and rare. However, they have an increased risk of postpartum psychosis, so getting worse during or after pregnancy and after delivery. Then I think there is a small proportion which we know of is post-traumatic stress disorder, and as a GP you might have come across, I've come across, most of the doctors have come across. It might not be just relevant to the delivery, but any traumatic event. I particularly deal with patients who might have had, for example, a miscarriage, a stillbirth, a traumatic birth, and that bad memory that lingers on, and they are scarred from having another child for a long period of time, and some patients are really good in kind of hiding it and sort of like keeping it away from your doctors or from your physicians for a longer period of time. But eventually, yes, it does come up. So the numbers quoted is less than 1%, but I always wonder it's much more than that, post-traumatic stress disorders, because women don't actually talk about it.
Yeah, that's absolutely right. Women don't talk about it, and this is why we're having this show, listeners. So those of you that have joined the show, thank you very much for listening to the show. It's wonderful that we can have you all on board and can have your support and actually spread the word, share the show. These are all for the benefit of yourselves so that we can gain an insight. It is perinatal, it is maternal mental health week. I keep on saying perinatal, but I'm right in a way. And it would be wonderful to have your text and WhatsApp on 07745278978, or to call us on our studio telephone number if you want to talk about it. Honestly, even if you're a man, come and talk about it. Do you have experience of your wife or your spouse or your partner who may have suffered from a perinatal mental health disorder. Would you like to share your experiences of how you think that it needs to be dealt with, or what you would like to see in services? It would be wonderful to have some input from you. So do call us on 01733602133. And I've got the wonderful Miss Afsheen Malik, who is a consultant obstetrician and gynaecologist at the Heart of England NHS Trust in the United Kingdom. Now, Miss Malik, talking about the diagnosis. Now, I'd like us to, because these are sort of shows for more information rather than speaking in medical jargon, for the purposes of our listeners who are listening in Bedfordshire, Luton and in Peterborough and UK-wide, would you like to please tell them or inform them of what are the signs and symptoms to look out for in a patient who is suffering from depression, who is pregnant or maybe had a miscarriage or has just given birth, please?
Yeah, I think trying to keep all the toolkits and all the, medical jargon out, absolutely right. I think in simple terms, there are few simple things which even non-professionals, family members can actually note as well. Or I think good for the self-assessment. Sometimes you feel that you're not quite yourself, if you're feeling low, if your mood is low, if you're not finding interest or pleasure in doing things which you used to do before and you used to really enjoy them, for example, going out on a walk or reading a book or something, and nothing of that sort interests you anymore, is probably one of the most important signs of depression.
Absolutely. Yeah.
And then, there are some physical signs as well which could come along, which might be easier to pick up by, family members. For example, you're not sleeping well, or you're not eating well. Eating well, most of the family members come in and say, this way, she's not really eating well and she's not eating. And we were saying, she needs to eat for 2 and all that. And so the appetite is really low. Sometimes, if there is a combination of depression and anxiety as well, you're finding it hard to go to sleep. So you go to bed and suddenly sort of like a rush of thoughts come into the head. You're thinking about 100 things at the same time. And I've heard, patients saying that there's a train of thoughts that come into my mind and I can't really put myself to rest. So, these kind of things, if you notice that it's there, then definitely you probably have one of maybe the mildest spectrum to maybe going on to a severer. Obviously, you need to have some help. Going to see your GP. If you're pregnant, mention it to the community midwife is definitely worth doing.
Okay, and it's good that you've brought this up actually, because there's a lot with regards to the physical symptomatology that one can feel with regards to eating, etc. And before we go on to a break, because it's 22 minutes past 7, I'd like to talk a little bit about the family unit around a lady that has just given birth. And I think that that's very important, because often from a cultural perspective, it's seen that the arrival of a new child in the family is a cause for celebration. It's wonderful and many people may be happy about that. But often what I have seen and what I've experienced myself is that the mother doesn't get the bonding and the privacy that she needs with her child, and it often the home, maternal home, is flocked with relatives who want to see the baby, who want to pick the baby up, who come over for as a means of a goodwill gesture. But often that doesn't really work very well, does it? Especially for somebody from a Southeast Asian ethnic identity.
This is very interesting, Shabina. Just, I think a couple of months ago, 3 months ago, I read an article, interesting name, saving a female patient from her attendance. It's a really interesting article. It's not much medical. And they just, incorporate the similar kind of things, what we're just talking about, that again, all the relatives and friends and family, they come across with goodwill, and yes, of course, it's a time of celebration. It's a time of happiness for the whole family. But I think the woman herself, there's physical pain, physical recovery as well. And again, there is a lot to deal with mentally. as well. You've mentioned it yourself very rightly before that, you know, you're not just recovering physically, but there's an additional burden of looking after a newborn, which you're not used to. Even if you've had children before, every baby is different. So you're dealing with yourself, you're trying to control your own symptoms, you're also looking after a baby. And on top of that, I think there's at least first couple of weeks you need to gauge out, to do what you need to do in terms of the baby, to understand yourself, the baby, and set up a routine. And in the politest and the nicest way, I think I could convey to all our listeners is that probably being support, or maybe at least asking when is the best time to come, maybe evening or maybe a couple of hours in a day is probably good, but the rest of the time for the new family to have that bonding and have that attachment is really good and useful.
That's wonderful. So I'm so glad that you closed that subject, because that's what we're going to be opening with. We're coming up to a break now. Like I said, it's been absolutely wonderful having Miss Malik on the show. We're talking about perinatal mental health here, a very important topic to women within the UK and the world over. So don't forget to join us again, where we've got this wonderful show. It'd be wonderful to have your calls, be wonderful for you to give us some comments on this very important topic. And obviously we do need the women and we do need the men to listen too. So don't forget to join us after the break on your very own The Body, Health and Mind Show.
Thinking about iftar? So are those who have nothing to break their fast with. Feed a fasting person at Masjid Al-Aqsa for just £6 a day, or give a family a whole month's supply of food for just £65 in a country of your choice. Make a difference to someone's life this Ramadan and earn multiple rewards from Allah. Now is the time to give. Visit humanappeal.org.uk or call 0161 225 0225.
Need advice on how to achieve your personal life goals? Then join us at Engage with Success, an empowering event with motivational talks and advice delivered by world-renowned life coach Paul Beck. Don't miss this unique program dedicated to your personal development and self-improvement. Sunday the 13th of May from 9:30 to 1 p.m. at Masjid Khadija and Islamic Centre, Cromwell Road, Peterborough. Tickets are only £10, spaces are limited and selling fast. To book, please visit the Salam Radio Facebook page or contact Faisal Mahmood on 07866 319 679. Engage with Success, Sunday the 13th of May, 9:30 at Masjid Khadija and Islamic Centre. Be a better you.
Need car parts quickly and at a great price? City Auto Parts offer competitive prices, trade accounts and a delivery service in and around Peterborough. For all your parts and accessories requirements, visit City Auto Parts, 30 Fitzwilliam Street, Peterborough, PE1 2RX. Call us on 01733 347711 or visit www.cityautoparts.co.uk.
Hate crime is a serious matter. Hate crime is a serious matter. It is important to report all incidents to give the best chance of prevention. If you're a victim or witness of any hate crime or incident, you can report it easily online at peterborough.gov.uk/hate crime. It only takes around 10 minutes and there's no waiting in line. You can choose whether to give your name or a further statement to the police. Please report any incident of hate, whether a victim or witness. As always, for emergencies, please dial 999. For non-emergency, please dial 101. Hate crime. Together, we can stop it.
Need a great place to chill out? Look no further than The Lounge for quality food and drinks at a great price. Try our varied menu: pasta, seafood, burgers, grills, salad, soup, rice and sides. Also hot and cold drinks, milkshakes and mocktails. Leave room for our exquisite desserts. The Lounge, 417 Lincoln Road, Peterborough. Call 01733 709 306 to order for delivery. The Lounge, friendly service with a great atmosphere.
When we are ready to go outdoors, we say, Bismillah, tawakkaltu ala Allah, wa la hawla wa la quwwata illa billah. Bismillah, tawakkaltu ala Allah, wa la hawla wa la quwwata illa billah. Bismillah, tawakkaltu ala Allah, ولا حول ولا قوة إلا بالله.
Wings against my window.
If you want to learn about Islam and Muslims, stay tuned to Salam Radio 106.2 FM.
Assalamu alaikum and welcome back. This is your very own Dr. Shabina Asad Qayyum with you on the Body Health and Mind Show on Salam Radio, Peterborough's only Muslim community radio station, broadcasted on 106.2 FM and online. I've remembered that off by heart. And we're also delighted to be broadcasted on Inspire FM 105.1. Having such a wonderful show. And do you know why we're having such a wonderful show? Because number one, our guest is wonderful. She's giving us such a good insight into perinatal mental health. And because I am absolutely overjoyed that we have gentlemen who are listening to our show. So I am going to call out, thank you very much for your thumbs up, Mr. Mehboob Ilahi. Thank you very much for your thumbs up, Mr. Muhammad Habibullah Khan. And of course, Brother Mukhtar Ali is watching us as well. So thank you very, very much indeed. I think it's very endearing that you are watching the show and supporting your women with their mental health issues. And before we went off for a break, we had Miss Afsheen Malik, who's a consultant obstetrician and gynaecologist at the Heartlands. It's not the Heartlands Hospital, is it? I keep on going on.
It is actually. It is Heartlands. So Heart of England Foundation Trust, Shabina, it constitutes 3 hospitals. It's Solihull,
right,
Heartlands, and Sutton Coldfield Good Hope Hospital. So it's three hospitals in our trust.
Wonderful. So we've just had Miss Malik rectify that for us at the Heart of England NHS Trust, Foundation Trust. And we're talking about perinatal mental health. And before we actually went on a break, we were talking about how the first couple of days, especially in the Southeast Asian community, how pertinent it is to give as much support as possible to the mother who has just given birth to the baby, and in the politest way possible, where we have lots of relatives rushing in. It's possibly a better idea to give a lady her space. And that's not only for bonding purposes, but I have to tell you, being a woman myself, the amount of privacy that is needed for a woman to tend to her personal care. And I don't need to elaborate on that much. It's enough for you to understand that she has to take care of her personal care in terms of her hygiene, in terms of her upkeep, which is also quite complementary to her mental health. But if she has so many people that she has to look after, if they're coming over, like some cultural issues can impact upon, then it's very difficult to do that, and that can have an impact on the mental health as well, isn't it, Miss Malik?
Absolutely, absolutely. We were just discussing that before the break, actually. And yes, I think apart from, as I was saying, not just the physical well-being, some patients might have had a cesarean section, difficulty in walking around, difficulty in mobility. So you probably do need some help as well. But I think it's important to have that privacy and that time to look after yourself, physically and mentally, getting used to a new baby, getting used to the new routine. So as I mentioned before, I think a couple of hours in a day is absolutely good for the visitors to come, but at least the rest of the time, as you mentioned, for there's so many activities which a new mom has to get used to, is really, really good and useful.
Yes. And in terms of yourself, at what stage do you actually see the patient? So we're talking now about treatment. We've spoken about how to be aware of the conditions before the break. Now let's talk a little bit about treatments. What do you actually do for a patient who presents to you with a perinatal mental health problem?
So, Shabina, I work within a team, a mental health team. We're very lucky in HEF that we have a consultant obstetrician, namely me, and I have 3 dedicated specialist health midwives, and we are very, very fortunate to have a perinatal psychiatry consultant as well.
Wow.
So we all within work that team. I mean, I think there's been lots of awareness, and there's money, a lot of money coming to the government as well. There have been 2 national surveys, one of them being Better Births, and that's put a lot of emphasis on improving maternal perinatal mental health. And therefore, a lot of money is coming through government to spend on the families, on the care of families, improve the maternal and neonatal bonding and all that. So most of the hospitals are developing into this team system now. So trying to keep it short. So basically, I see the patient within my antenatal clinic, those either with the pre-existing mental health disorders or those who've recently been diagnosed with a new disorder. I sort of like, apart from that mental health, there's so many other risk factors we take into account and make an individualized plan for each and every patient.
Right.
I liaise, obviously, we work within a team, as I mentioned. So most of the patients I see with the specialist mental health midwife. And very recently, as part of a new project which we are doing within Birmingham, it's called BUM Project, where we are trying to standardize the care for all the women across Birmingham. So it doesn't matter if you're born, if you're living in Solihull or Birmingham or Erdington, every woman is going to have that same treatment, which is so important to reduce and eliminate that inequality of treatment among different parts of the same area. So we've started our joint mental health antenatal clinics as well. So some patients I see within that whole group setting with a psychiatrist and mental health midwife. And then depending upon different patients and different spectrum of disease, we may offer in terms of treatment some counseling, some cognitive behavioral therapy, or again different type of counseling or psychotherapy, or some of them may need a treatment in the form of tablets or medication.
So just basically to what I think needs to be done is that we need to obviously concentrate on what Miss Malik has said. I think we've got a caller on the line. I'm going to take this call if that's okay, which is great. So just going to take the call. Hello, Assalamu alaikum. You're live on Salam Radio.
Yes, Assalamu alaikum. My name is Ali.
Assalamu alaikum, Brother Ali. How can we help you?
Yeah, I just want to ask a question to Miss Malik.
Of course.
Actually, my friend's wife, she's working in nursery, and she's 7 weeks pregnant.
Okay.
And she is exposed to a child who was a chicken pox.
Okay.
And she's due to see GP maybe next week.
Sure.
But she's anxious that what to do next.
Okay, no worries at all. So she's been exposed to chicken pox, has she?
Yeah.
Now, would you like to answer this question, Miss Malik?
Yes. So how many weeks is she? I missed that bit.
7 weeks.
7 weeks.
7 weeks pregnant.
Yeah.
7 weeks pregnant. She's been exposed to chicken pox. So I think the first thing is to avoid contact with the rest of the pregnant moms. If she works at a nursery, I think I heard you mention that. So staying away from other children. And then definitely seeing the GP. What she needs is some specific blood test to check if she's got any immunity to chickenpox or not. And a lot of patients already have, those cells and that immunity against chickenpox. But if she doesn't, then she needs to be referred urgently to obstetric team who will do specialist scans and then take it further.
Okay.
Because she's due to see maybe next week, so does she wait long, or because it's the bank holiday now?
I think what's going to happen, Brother Ali, is that as soon as when she sees her GP next week, there's no cause for an emergency. If there was a dire urgency, they would have assessed that already and probably referred her there and then. But she will have to undertake that blood test to see if she has immunity, and from there on they will be able to, as she's 7 weeks, I'm assuming, Miss Malik, that's quite early stages, isn't it?
Absolutely. It's within the first trimester. So I think the first step is always to our listener, it's to get that test done, avoid exposure. So in case she's actually infected, to prevent that infection, for example, if she's working in a nursery, other pregnant moms and other young children, and then based upon the result of the test to take it further, whether or not to be referred to the obstetric team or not for specialist scanning.
Okay. Does that answer your question, Brother Ali?
Yes. Thank you. Thanks
Thank you very much for calling Salam Radio. Thank you. Bye. That was Brother Ali, who asked a question a little bit about, not really relating to perinatal mental health, but I hope that has answered his question. Now, we do have a Sister Qasir Rukhsar, and I know that she does a wonderful job. This is Sister Rukhsana Qasir within Peterborough, and I'd just like to give her a mention here because of the tremendous amount of effort she has made in setting up a women's group. Miss Malik, she's set a women's group up, and she's very motivational. Every single Monday she will be writing all of us messages, and it's a private forum for women within the Peterborough area to share their problems and to gain advice. And she has listened to this show, and her online group on Facebook is known as the Peterborough Women's Association. It's specifically for support. So I'm very, very glad and privileged that you are listening today, Sister Rukhsana Qasir, and hopefully we'll be able to share this show and many people can benefit from it. So you were talking a little bit about how you manage these patients. Now, in terms of pregnancy, there's rather quite a blanket cover for giving medications in women who are pregnant if they are depressed. Is that something that you initiate, or is this something that you would advise to the GP, Miss Malik?
Shabina, that's a very good question. It's a really, really practical question as well, and this is something which we come across quite often. I think the important one takeaway message today is that if you are on any antidepressants or any medication with a disease which is well controlled and stable, then please do not stop that medication and continue until you see the consultant in the hospital. As in, in the antenatal clinic. And where, we have to initiate, I often initiate, for example, antidepressants, a patient who I clearly think needs some help. I often sort of give them a prescription for antidepressants. Sometimes I refer to the consultant psychiatrist if I think she may benefit from counseling or needs a little bit more than just simple antidepressants. I think if we have decided with the patient that she needs antidepressants, she's happy, then I don't think so there's any need to delay that and handing that work over to the GP. We are very capable of prescribing that medication to the patient, and that's really important for the timely treatment as well once you've made a decision and you've discussed with the patient.
That's very well put, Miss Malik. And the thing that I think I'd like to ask you following on from that is that there is the notion in very many people, especially in the Southeast Asian community, which is why we're having this show, is that people get addicted to antidepressants. Would you like to squash that myth?
Oh, absolutely. Absolutely. These are the kind of beliefs and your thoughts, you're fighting every single day, and it's a myth, to put it at the least, it's a myth. It is nothing like that. Antidepressants are a medication. It's a treatment like any other medication. For example, if you're diabetic and you need insulin, you don't get addicted to it. Your body needs it, and this is why you have insulin. And similarly, if you are on antidepressants and you're actually feeling well and you're able to do your everyday function and you're able to live happily, then this is what your body needs. So this is as important as having any other medication for any other physical illness. So no, the simple answer is you do not get addicted to any of the antidepressants. And again, the important thing is you continue as long as you need it. If you've been on antidepressants for a very long time and now you think some things have changed and you want to stop, then by all means, you can stop, you can see your GP and you can certainly stop that medication. But there is nothing at all like that they are addictive or they make you addicted to anything in particular. No.
Okay, thank you very much for squashing that myth. And often what I say to patients when they come in is that sometimes we have these little receptors in our brain which have the ability to be able to flush out the negative and keep a good balance, because you've got your happy hormones and the chemicals that enable us to negotiate things in life. And sometimes they become overclogged, and they're like little shock absorbers. So they become overclogged, and sometimes you need a little something to clear out those shock absorbers. So that's sometimes the analogy that I give people, and they're not addictive. But there is a concern, isn't there, Miss Malik, with coming off antidepressants all of a sudden? It can cause rebound symptoms of depression.
Oh, absolutely, absolutely. You know, those patients who are actually, this is applicable, Shabina, obviously, you know, to those women or those patients who are on higher doses of antidepressants, which is a small proportion. But yes, you know, the best thing, if you're on a higher doses of any antidepressants, then the best thing is, like any other medication, to taper it off slowly and gradually over a period of time, and get your body get used to it as well. So if you're on, for example, 150 dose, then bring down to 100 milligrams for a couple of weeks or maybe 4 weeks or something, and then in consultation with your GP, you know, slowly and gradually taper it off or stop it if it needs to be done.
That's true. And I've got a, Sister Ruxana Qasir is saying that there's nothing wrong with antidepressants when you take them. They do help, and how right you are, and how right you are as well, Miss Malik. So thank you very much. We have a Mr. Majid Hussain who's joined us, Salman Siddiqui who's joined us. Do you know, I'm so overwhelmed that gentlemen have joined this show to listen in and to be aware of what your female peers or your counterparts go through, because believe me, the input that you give your other halves is instrumental to their well-being. So yes, nothing is lost in giving your other half a little bit of what I call TLC, tender loving care, because it's instrumental and the support they need. You know, we do go under quite a lot, us women do. We do go through a lot. We're giving birth to babies, etc. Our bodies are changing. We have to keep up appearances for our husbands. And it's a tough job being a mum and being a wife as well. So yeah, I know that lots of you appreciate your other halves, but during this time, especially a sensitive time, it'd be very much, I think, complimentary if you were to take care of your other half. So please do take care of her. She's valuable. And that's one of the reasons why Allah subhanahu wa ta'ala has placed Jannah under her feet as well. So
absolutely, absolutely, Shabina. I mean, this is something so important in our cultures, you know, to have that support. I mean, so many families who don't have many other family members living around, so the partner or the husband is the only person, you know, giving that support. So if your husband is understanding and is able to give you that support, nothing better than that.
Absolutely. Now, talking about outside agencies with regards to counselling, etc. Now, when a person has, or when a female or when a woman gives birth, often what happens is that they don't have the time to go to counsellors. Are there any support agencies that we can signpost the sisters that are listening to? Is there anything they can do? Pick the phone up, or online, or any other therapies other than medication that they can undertake, Miss Malik?
Definitely. Again, very valid question, Shabina. It's a really good question, and I think there are lots of charities. If you put on Google, there are lots of charities which come up, working for different disorders. For example, on depression, because it's so common, and you'll find lots of charities working on that. Other than that, there's lots of agencies as well. Acacia, I think, is one of a very useful one, you know, which is particularly for our region. I'm not sure, you know, particularly for Luton and Peterborough area. Acacia, I think, is quite a widespread one, and it actually gives support not just to the women and the families as well. Yeah. And then online, if you go, there is so action on postpartum psychosis, APP. It comes up as APP, action on postpartum psychosis. There's lots of online tools and how to contact them and how to arrange counseling and further discussion. Right. There is Association of Postnatal Depression. There's Birth Trauma Association. And, very important thing is actually, it just came to my mind, Royal College of Psychiatry has a lot of patient information leaflets, which I find them extremely useful. Wonderful. Just for basic understanding and basic, knowing the symptoms. They range from anxiety to depression to bipolar disorders and anything and everything you can think of. There's a very simple language for any layman to understand. It's very, very useful.
Okay. So that's a really good idea, actually, because when we talk about the Peterborough Women's Association, one of the things that one can signpost them to is actually the Royal College of Psychiatry. So listeners, if you are listening in, Miss Malik has already elaborated on the outside agencies. Now, I don't think we have a case share here within Luton and Peterborough. We do have something known as the IAPT service, which is for the whole of Cambridgeshire, and it's a self-referral counselling. And the number for that is 0300 300 0055, where you can speak to somebody over the telephone and refer yourself for some type of counselling. The other thing that I usually do, and something that I've done myself, is to download mindfulness apps, which are relaxation apps on the iPhone if you've got a smartphone. So you've got mindfulness apps like Headspace and Calm, for example, which I find very useful.
Actually, I've got Calm as well. If you mentioned that, that's a really, really useful one.
Yes, that's right. And I've got Headspace, actually. So, yeah, we need it. We do need it, other than just presenting on the radio and Miss Malik going and do her job as an obstetrician and looking after all of these wonderful ladies who are suffering from mental health problems. We do need to relax as well. So, yes, we do have a life outside our job. So that's very, very important. So that's an example there for you. And we have Mr. Azhar Chaudhry, who's given us a thumbs up. Always a pleasure to have you on board, Azhar Bhai. Thank you very much for joining us. He's a distinguished GP within the Peterborough area, and he's a very, very good doctor to his patients, so much so that sometimes I feel really rather envious of him. Has he got more fans than I have? I certainly think he does. So I've got a question here from a sister Asia from Luton, and I'm so glad that I have my Luton listeners that listen to me quite often. She says, I suffered from postnatal psychosis. I just want to tell the listeners out there that please don't feel ashamed of approaching your GP or even talking about it to your midwife or health visitor. I was in such a state, but this was because I let my postnatal depression go on for so long, to the point that I had to take medication and was nearly admitted into a hospital for it. So well done to you, Sister Asia, and thank you for sharing your experience with us as well. And in terms of Miss Malik, we've spoken about outside agencies, outside charities. Do you think that there is the need for improvement and a greater spectrum or a greater breadth of services do you think that this category of women, obviously in Birmingham we have a setup which is wonderful like you described, but I do feel within Peterborough especially there is a need for more services relating to perinatal mental health, and these ladies do need more support.
I can't agree more with you, Shabina. I think, as I mentioned, according to one of the recent statistics, at least 75 to 80% of the women across the country, they do not have access to specialist mental health services. And that is a huge number. If you think about, we are living in a developed society where there's free access to NHS, but still majority of the women do not have access to specialist mental health services. I think, as I said, there's lots of money spared from government to improve mental health services. So hopefully in the next few years, you will see some improvements. I personally feel that one area where we really need to improve upon is the postnatal follow-up and postnatal care. I think most of the hospitals are providing good enough care, maybe, during pregnancy and immediate postnatal up to 3 to 5 days after delivery. But once the patient has been discharged by the community midwife, which is usually 2 to 3 weeks time, then after that, who does she contact and what does she do? And because she's left at the GP's, with the GP surgery, who might or might not have an interest in mental health. And, so that's an area which needs a lot of input, and what we are trying here locally is to we are getting some funding to train some community midwife, perinatal mental health midwives, who will be able to follow up these patients for a longer period of time and give that much needed support and much needed care after the delivery as well, because this is a very, very vulnerable time for women after the delivery in particular.
Yes, it is. It's a very vulnerable time. And I think that this is an area that really doesn't fall specifically and wholly into psychiatry, and specifically doesn't fall into under a obstetric remit. It's sort of a bit of both, isn't it? And it's true, because after a week of seeing the midwife, you're then left to fend for yourself really and get on with it, and your child will be weighed by the health visitor. But sometimes I feel that there is a really big discrepancy in when you identify a woman who has depression, and this is a fact, and I think in the last couple of minutes, actually we're closing up now, but it's very important to ascertain the difference between a lady who is depressed because she has just given birth and a lady who has been depressed for a very long time for other factors. And it's been such a wonderful show, and I think that we've gained so much from this, Miss Malik. I think that I would like to have you on my show again to explain a lot about this and talk about this. And you were right, because we didn't have enough time. I still have very many questions, but what we will do hopefully is there any last message you would like to give to all the pregnant women or ones that have given birth out there?
Yes, I think going back to your last caller, Asiya, I think that was a lovely, lovely message, Asiya. I think, the way how you came forward and talked about that, I think one message, if anybody could take from this show and all this discussion, is that please, be open about mental health problems. If you have a friend or a family member, be supportive, try to be a little bit more understanding. If you've suffered yourself, then please be open and create that awareness around you. They are as important to be treated and to be detected as any other physical illness. So I think that's the take-home message to all of the listeners who are listening to this show today.
Well, thank you very, very much, Miss Malik. Thank you very much. And I'm sure that we've all benefited from it. And hopefully I will be hosting you again in the very near future.
Thank you very much, Shabina. It was lovely talking and some good, interesting questions came up. And I look forward to talking to everybody again.
Yes, hopefully. And assalamu alaikum to you.
Assalam. Thank you very much.
Now, that was the wonderful Miss Malik, and I hope that we were able to talk about many things surrounding perinatal mental health. It's given me an initiative to try and talk about this and set up some type of a service within Peterborough and indeed Luton. Well, join me next week for another Body, Health and Mind show.
Your number one for local, national